Hello, we're so delighted to see you all today. Those of you who are joining us on Facebook Live, we are today welcoming Jillian Heath with us to talk about reconnecting to your core. So Jill is a pelvic floor physical therapist in the Arcadia area with She PT. And she's going to talk to us today about all those things that happen in pregnancy and afterwards, and that many of us are still holding on to that might be common, but aren't necessarily normal for postpartum families. So thanks so much, Jill, for being here with us today. I'm going to go ahead and turn it over to you.
All right. Thank you for that great introduction. Yeah. I'm Jill Heath. I'm a pelvic physical therapist. And so what that means is I help moms during and after pregnancy with things such as back pain, pelvic pain, issues around bowel, bladder, sex. So all of those things that we know change quite a bit with being pregnant and having kids. So I'm going to go ahead and share my screen here. Oops. Shucks, it looks like I'm not able to. It says host disabled attendee screen sharing.
Try now.
Okay. All right. That's working. Let's see. Let's get to present here. Okay, so all those things that that happen with pregnancy and having a baby, and we know that it's super common, and I think it can be really confusing, especially in this time that we're in, kind of knowing, for moms to know what's normal and what's not normal, and then knowing what to do, because we just aren't given a whole lot of guidance. And I think we also get a lot of mixed messages in our culture. We have kind of on one extreme, we have this idea of, you know, everything's fine, nothing's happened to you, and you should bounce back and be back to business as usual at 6 weeks. And then we kind of have the other extreme of, this is your new normal, and this is how your body is now, and there's nothing you can do about it. So I think today I kind of want to see where we can sort of land somewhere in the middle of, you know, accepting that our body has been through a lot and some of the things that can go along with it, and then recognizing where maybe we can kind of work on those things. So one of the ways that we as pelvic therapists help moms with that kind of recovery and getting that balance back is by helping them with reconnecting to the core. So I first kind of want to go over what that means, and more importantly, kind of what the core doesn't mean when I say that. But what it isn't is just abs. And I think that's what we all kind of tend to think about. And maybe we all kind of like grip our abs when we even hear the word core, you know, because we hear in the classes to engage your core and keep your core tight and all of that. But instead of thinking of the abs as being the core is really this core canister. So it's really this whole area from your rib cage down to your pelvis, that whole area. And these big muscle groups are the ones that all kind of have to work in balance together. So on the top is the diaphragm, and that's our breathing muscle. On the back muscles. On the bottom is the pelvic floor. So it's like supporting that whole canister. And then on the front is the abs and lots of fascia. But all of these muscles have to work in balance. And that's what gives us our support, like our whole support from, you know, it's from the center of our body that gives support to everything. So everything from, you know, picking up our baby to holding our baby for a long time and getting up off the floor, that balance has to be there. So obviously during pregnancy, like all of those muscles change quite a bit. And, you know, I think we can all relate to that diaphragm. So that's our breathing muscle. You know, those last weeks or maybe months of pregnancy, like we just can't catch a full breath because the baby is taking up so much space. Our back muscles, of course, change because our posture adapts to making way for the baby. and the abs go under a long stretch. There's a big stretch that happens there, and an abdominal separation, which is, I think that's kind of an area of controversy or some misconception right now that, you know, moms get really worried during pregnancy that their abs are separating. Well, it's totally normal. Like those, they have to go somewhere in order for that baby to grow. It's just a matter of after the baby's born, kind of how does that settle back into functional abs. But and then the pelvic floor during pregnancy is like, you know, basically like holding up a bowling ball for a period of time. And so it goes under this long stretch. So even during pregnancy, just with the pregnancy aspect, there's like a ton of changes. And then of course with birth, stretching of the pelvic floor and the abs, whether it's a cesarean or a vaginal birth, the stretching of those muscles, as well as some scarring and disruption to the tissue can really impact things. So I also like to point this out too for any of the moms who have had cesareans, which my kids were both, I had 2 C-sections with my kids. If you think about like all of that time that the pelvic floor is impacted during the pregnancy, it's pretty common to have pelvic floor issues with a C-section. So I think a lot of moms think if they had a C-section, their pelvic floor was basically like, you know, literally like left untouched, but it's actually has been through a lot too, especially if there was any kind of pushing phase or you know, a long labor phase before they kind of changed routes and decided to go a C-section. So I think it's important to, I think that's pretty uncommon, or it's pretty common for moms to not have that information. I should also say too, I can't see if there's any chats, if anybody has any questions, I can't see the chat. So if you do want to like pipe in and say something, or if someone wants to read me the chat, if there's any questions that come up, feel free to jump in.
For sure. I think we're mostly just chatting about the fact that it took us so much. Well, it's still taking us a lot of time. Yeah. 4-year-olds and still trying to heal and recover and come back into ourselves. And yeah, me with the 6 and Sarah as well.
Yeah. It does. It takes a long time. You know, these changes went over for a long time. And I think just looking at all the things that are changed, and this is just from like kind of a muscular, physical kind of point of view, not even touching on the hormones and all of the other things, but it's completely reasonable that we should not be expected to just bounce back from this right away. So I'm going to kind of talk through some of the common issues postpartum in terms of pelvic floor and core issues. And this is certainly like, and I think we could have a separate topic on each and every one for like a whole year, but so it certainly is not all inclusive. And but to just give us a little bit of an idea. So through a little bit of humor in here, because it's good to at least be able to laugh about this to some extent. So I think this is the one that everyone is kind of really resonates with everybody. If you enjoy drinking cold coffee, never having time to sleep, and peeing your pants as a full-grown adult, then I highly recommend having kids. So I think we can all relate to at least one aspect of that for sure.
Absolutely.
Welcome to motherhood. You now cross your legs when you sneeze. So this one has already come up a couple times with the intros, but super common. This is teasing is a funny way to put it, I think, but stress incontinence is when there is, if you picture that core canister, there's so much pressure coming from up above, and that pelvic floor just isn't able to withstand it. So we see leaking of urine or leaking of stool in a lot of cases, with sneezing, with coughing, jumping, running, kind of anything that is increasing that pressure that's inside that canister. And the pelvic floor is just not able to withstand that. Jumping on the trampoline, right? But I think when that happens, I think it's either kind of instinctive and or we turn to Google and try to solve our issues and start doing Kegels or like just squeezing the pelvic floor like crazy, either every time one of those episodes comes around or you feel like a sneeze is coming on, so you squeeze your pelvic floor super tight, or you just start like holding it really tight all the time because you're afraid of what if that leaking happens now to me. And maybe for some moms that can be helpful, but for the most part, that actually isn't helpful, and it can be kind of counterproductive. And the reason why is, so this trampoline, not only can we have the leaking with the trampoline, but I want you to think of the pelvic floor as being like a trampoline where, I'll just show the pelvis here. But if this muscle group is like sitting like this, that pelvic floor with like a trampoline needs to go down in order to come up. So when it comes up, it gets that good stability and that good strong contraction so that it can support the bladder and it can close off the urethra or the holes, so we're not peeing. But it has to go down in order to come up. And so that idea of just Kegeling and kind of holding tension there can actually make it worse. So towards a little bit later, I'll kind of talk about, how can we get that release of the muscle and kind of get some of that balance back. Any questions so far? Anything that you need to clarify? Okay.
I think everybody's just laughing about the
You're good. Laughing. Okay. It is, yeah. So again, and it's like I said, it's super common. It's around half of women after having kids are experiencing it, at least in the beginning stage. And but it's not normal, right? Like we're looking at all the reasons why that's not normal, and kind of we'll talk a little bit about how we can work with it. So another issue that's super common with new moms, irony is you having to get out of bed every 3 hours to pee while your kids finally sleep through the night. And I think this one is like, I read this, I'm like, yep, yeah, that is so frustrating. You've been waiting for months to be able to sleep through the night, and then now the interruption is having to get up to go to the bathroom. So you might hear a lot of moms say like, oh, I have a small bladder now that I have kids. And we know that the bladder didn't actually get smaller, but we have retrained it during pregnancy to not hold as much. So if you think of this cup being like this cup is like your bladder, and during pregnancy or before pregnancy, it was able to fill up like all the way or maybe almost all the way. And you get, when it's kind of towards the top, then you get that signal, that urge to go, and so you go. And then during pregnancy, of course, that baby is taking up all that space and sitting on your bladder. And so your bladder can maybe only fill up this much or maybe even less than that. And so when that's as full as it can go, then you get that signal and you have to go. And then we can also start to get into some habits with that because, maybe we're worried that we're not going to be able to hold it for a whole, meeting or something. And so we go just in case before the meeting. And then after having the baby, we kind of keep up with those habits. When we get up during the night to feed the baby, we go to the bathroom because we don't want to have to wake up again. And so soon we've basically trained our bladder that it's only capable of holding this much. So certainly there's some cases where this is more complex. So if one is, if you had to have a catheter during your birth, then that can sometimes kind of mix up those signals and disrupt that kind of the signal between your bladder and your nervous system. And of course, if you have any pain with urinating, along with that urgency or history of frequent UTIs, those are cases where it's certainly a little bit more involved. And I would certainly recommend working with a therapist that can help you sort out what's going on with your bladder and pelvic floor. But in a lot of cases, we can kind of work with our habits to increase our bladder's capacity. So you can kind of do a self-inventory of just asking yourself these questions. First, I ask the moms, how often do you go? Are you going like every half an hour, every 3 hours? Normal is about every 2 to 3 hours, and that ends up being about 6 to 8 times a day. And perhaps if you're a mom that, you just drink tons of water throughout the day, you might go more often, but kind of you can count while you're peeing and see how long is it actually taking. If it's just a few seconds, then maybe you're not taking advantage of your bladder's capacity. But if you're going for like a count of at least 8 Mississippis, then you probably have a pretty good pattern going on there. Another question is, do you go just in case, which I think a lot of us are pretty guilty of, and maybe guilty of having our kids do too. Because if we're heading out the door, we don't, it's like, oh, I don't want to have to deal with that grocery store bathroom. So I'm going to go just in case right now, even though you don't have to go. And so each time you're kind of reinforcing those habits with your bladder. So certainly I'm not suggesting to like push the limit, if you're going to go out for like a long hike, don't test it out then, but test it out with little things where it's a little bit of a safer environment, and see if you can kind of start to extend your bladder's capacity a bit. Really, and then of course, what's that?
That's really fascinating. I actually thought I was being bad to myself by because there are times when I basically make myself wait an hour before I pee, which I was like, you're doing something awful to your bladder. I mean, I don't know, maybe that's not what you actually meant, but, but yeah. That's really interesting that you're saying that it's good to like kind of test it out instead of assuming it's not going to do well. That's really fascinating, actually.
Yeah, certainly don't like put yourself through pain with it, but yeah, as long as you're in kind of a safe situation where there's a bathroom close by, and you don't have kind of other things going on with it, then certainly, yeah, you're not being mean to your bladder at all.
Yeah.
And then when asking yourself, when do you drink most of your water? And this might sound obvious, but I think as moms, like we're just super busy. And so sometimes you can just go like the whole day and realize that you've hardly had any of your water, especially I think nursing moms are just so concerned about making sure that they get enough water, which is great. But then if we wait until 7 o'clock, and then that's when we're trying to catch up, of course you're going to be getting up a lot at night. So as much as possible, trying to be consistent throughout the day. It's just better for your whole system, better for your bladder, and then being able to not drink quite as much in those couple hours before bed, just so you can get back on a better schedule.
Actually, if that's okay. Yeah. It seems to be a really popular slide for questions. All right, hold on. Okay, here we go. So, Amy says, so glad you're talking about this. So many clients struggle with this and have misconceptions about healthy bladders and peeing frequency. Sarah says, guilty. Tiff says, I never thought about it that way. I'm definitely guilty of doing it for myself and with my kids to avoid public bathrooms or pulling over on a car ride to potty. I'm definitely a let's just go in case, LOL. Amy says, it's shocking how long bladder can hold after that first little twinge. And then Sarah says, what if you struggle with UTIs?
So with UTIs, I would have a few questions. So first of all, depends on how often you're having UTIs. And I would think it'd be, if it's something where it's pretty frequent, something you struggle with quite a bit, having it ruled out that it is actually a UTI issue. Are they doing a culture, like a catheter culture, with it to make sure that that's what's going on? Or is it, oh, I've had so many, so now they just give the antibiotics or whatever. So a lot of times pelvic floor tightness and increased tone in the pelvic floor can, so kind of more tension, like I was talking about before, can mimic the symptoms of UTIs. So it can feel like that bladder pain when it's actually coming from the pelvic floor. So in that case, it would be most important to, once you've ruled out kind of the medical infection situation, seeing a pelvic therapist to, and you could even have the assessment by the pelvic therapist to see kind of what's going on with your muscles, and are we able to reproduce that sensation that you feel with kind of examining the pelvic floor muscles.
Okay. And then the next question, is it bad to feel the urge and ignore it and it goes away?
No. I mean, so you're going to get like your bladder and brain kind of give you different signals. So you're going to get to like maybe that halfway point where you might get that first urge. And, you know, you can recognize it as like, oh, I think maybe I have to go, but maybe not for a little while, you know, and you might be asking yourself, where's the bathroom? So that when, you know, I'm going to have to go maybe in half an hour or an hour or something. And that should subside. And then you get another urge when it kind of gets to like that next threshold. Mm-hmm. So of like, okay, now I really have to go to the bathroom.
Okay, awesome. And there's a lot of people saying, normal to large degree, I've always been taught to listen to the moment. Your body communicates a cue, not to ignore any signals. Robin says, many of us as kids had our parents or guardians urge us to go before we left the house. Although it makes sense, especially for kids, it can lead to a bad habit of JICing. I don't know what that means, but then.
Just in case.
Okay.
Just in case, yep.
And Tiff says, maybe that's my issue. I get symptoms of UTI with no infection often. Huh. Very cool. I mean, mm-hmm. Not cool. That's not good, but it's really interesting that you're also, yeah.
Yeah, there's awesome. A lot going on with it. Okay, and then the last one for that is just checking to see if these kinds of feelings are worse when you're drinking a lot of the bladder irritants. So it's, of course, like all the fun things, coffee, tea, wine, sparkling water, that can be irritating to the bladder. And certainly you don't have to eliminate them in most cases, but just being conscious of it and drinking a lot of water kind of around that can help to just dilute the environment and make your bladder not feel so irritated. Mm. All right. So this one is, have to have a little humor with it. Do your Kegels, dear. It's nice to have your vagina stay inside your body. So I put this up here for humor. It's certainly not as Kegels are the solution to all the problems, but for us to talk about pelvic organ prolapse. So pelvic organ prolapse is, I'm just going to show the pelvic model here. Here's a pelvis from the front. You can kind of see inside, situated inside that bowl, that pelvic rim is, we have the rectum, the uterus, and the bladder that are all supported in there and supported by a whole series of ligaments and fascia and connective tissue and muscles. So all of those guys are helping to kind of keep the organs in an ideal place. And with birth, that stretching and possible injury to any of those parts can make it to where those organs just aren't supported as properly. So in this case, gravity kind of takes hold and we can have the organs kind of descending down, and it can be putting pressure on the walls of the vagina or the rectum. So kind of the symptoms that go along with prolapse, because sometimes these aren't as obvious to us as some other things, but kind of a feeling of heaviness or bulging in the vagina or rectum. It can feel like a tampon is falling out. That's how a lot of women describe it. It can be accompanied by an achy low back pain, like a really low back, kind of deep achy pain that gets worse throughout the day or after standing for a long time. And it can be accompanied by leaking of urine or stool, but not always. So the big thing that I want to get across with prolapse is that it is super common, and it's also not, you know, one of those things. It's super common, but not normal, and it's very, very treatable. And we work with it quite a bit. And I like to have moms think about it more as kind of a dynamic situation where it's not like something is out of place and we have to necessarily like, how can we get it to go back in place? It's more of there's too much movement happening with these organs because there's not as much support holding them up. And so gravity is kind of winning the game here. So with our treatment, we're really just trying to get that whole core system to support the organs more than gravity is kind of pulling on it. So some of the things that we can do kind of early on in terms of maybe prevention or at least kind of lessening the severity is just being aware of taking that time to rest in those early weeks. So the first 3 months that the pelvic floor, I'm just going to show that pelvis again. This area is just kind of more, there's more mobility, there's more stretch there. And so kind of in those weeks, taking that time to rest and not being up on our feet too much to where there's a pressure on that area that's trying to heal. If you are on your feet for periods of time and have an opportunity to like lie down flat to where you're kind of taking away some pressure, that can be helpful too. And I know there's lots of schools of thought on kind of how much rest and things like that, but you know, just not excessively on your feet. Another thing is to be intentional about your digestion. So avoiding constipation in those early weeks. And I know it's a big thing. It's hard it is difficult to have those first bowel movements after having a baby. But as much as you can do to kind of avoid constipation and help your digestive system with eating things that are easy to digest, like soups or, you know, cooked vegetables, chewing your food really thoroughly so that it's not overwhelming your digestive system. And the reason why is so that you're not adding like basically more load to your pelvis, and also not having to strain. So straining for bowel movements just kind of like puts more pressure down on it. Along with that, using a squatty potty or a stool for going to the bathroom, where it just puts your pelvis in a better position and, you know, less strain on the whole area.
Jill, I have another question if you don't
Okay.
mind.
Yep.
Tiff asked, can you touch on low cervix or cervix that moves when you bear down after childbirth? She said cervix was normal prior, and then she added, I know the cervix changes depending on where you are in your cycle, but after a few pelvic exams, it seems my cervix is just generally lower than it used to be or is supposed to be. Also, is the urethra being lower on the vulva a thing, like urethral prolapse? I know what my vulva looked like before kids, and it's definitely not the same now.
Yeah, so both of those things would be kind of related to what I'm mentioning. The cervix being kind of like the lowermost point of the uterus. You know, if that uterus isn't supported up there by the main ligaments and all the connective tissue, then it is going to put the cervix in a different position. Same thing with the urethra. So I kind of touched on the bladder, you know, the bladder being one of them that's supported. The urethra is also kind of held in place by a few muscles and some connective tissue. So yeah, you can, that can kind of change how it appears, and it doesn't have that support. There might be some leaking with that. So that kind of goes along with this. So in terms of what we do, you know, in therapy for those cases is we kind of look at where exactly in the pelvic floor is the, I don't want to say the weakness necessarily, but the imbalance, you know, and where can we, I'm just going to show the pelvis here, like inside the pelvic floor, where can we find the most opportunity to bring in some more strength and coordination to support those. So, and if Amy or Robin, if you guys want to kick in, chime in too, if you have any more to add with that, I'd welcome your thoughts.
Well, I was glad that Sarah commented in the chats. Hi guys, it's Amy. About the cervix and the uterus changing position during your cycle. Because I think that's important to know, that a little bit of increased heaviness might be normal during that time, or just that feeling of pressure. But yeah, I mean, it's definitely treatable. I was trying to see if I could see any of the questions in the chat too. I'm sorry, Jill, did you already say something about the urethral position?
Mm-hmm.
Okay.
Yeah, were there any other questions with that?
That's all that was in the chat.
That was all. Okay. Okay.
I was curious, I'm not going to type it in the chat, but I was just going to chime in. What do you typically do to treat that in therapy? Like, what are your methods or your options for doing that?
Sure. So kind of what it looks like is we do an assessment to see, we first look at kind of when you're straining your system. So we try to kind of mimic something that would provoke it. So maybe you feel the symptoms when you're standing for a long time, or you're squatting, or you're having to lift something heavy. We assess your pelvic floor during those things to see at what point is that movement occurring. And from there, we know which muscles we need to strengthen, which ones maybe are active too much. And then we kind of work with different positions to kind of bring more coordination to that area. There also can be kind of around the whole abdomen and pelvic girdle, or, you know, pelvis, there can be areas of restrictions in the fascia, or the organs aren't, you know, kind of moving optimally. So we kind of do some hands-on techniques to get everything moving effectively there. So it is a process, and I would say too that it can kind of fluctuate throughout life. So maybe, you know, in those early months after having the baby, it's pretty pronounced, and then maybe it resolves on its own. But then maybe it can either pop up, like we talked about with cycles, you know, as there's more heaviness there. Maybe you only have your symptoms during your cycle, or menopause. It might kind of reappear at that time. So hopefully that kind of answers your questions in terms of what we do for therapy with it.
You said in the chat, is it internal massage or yoni eggs or something that's recommended?
Got it. So in terms of internal massage, as pelvic therapists, we do an internal assessment to assess all the muscles and kind of feel what's going on there, and assess that vaginally. And so if there's areas of muscles that are tighter than others that need to be released, then yes, we do spend time kind of working on that. In some cases, we teach patients how to do it on their own, or it's something that we just do in the clinic. And sometimes we will use vaginal weights. I don't know, we all kind of do things a little differently. I tend to kind of use more like teaching how to properly engage the pelvic floor with the breath, which is what I'll talk about in just a minute, and adding that into kind of the things that are bothering your symptoms. So like I mentioned, like lifting and squatting. So kind of adding those in there so that we're teaching your muscles in the position that they need to be able to be effective.
Yeah, you got some more questions in here too. This part seems to be really, really initiating a lot of chat.
It's a
Robin was
lot,
saying,
yeah.
yeah, interesting things with prolapse and research done. Some women have no symptoms with a stage 1 prolapse and some will. So I always encourage women to see a pelvic PT, even if mild symptoms, so a thorough eval can be done and you can know how to help it now and hopefully prevent continued worsening symptoms. And then Joanne asked, does having a tilted uterus play into any of this, or is that a whole different and unrelated thing?
Tilted uterus, I don't know that it plays into it as much. So what I think about with a tilted uterus is sometimes there can be some asymmetries in the kind of the ligament support, and that's why it's tilted, or kind of the pelvic, maybe some tilting going around kind of all these bony structures. So in that sense, not necessarily related to prolapse, but it could. I don't know. Amy and Robin, do you have any thoughts on that?
I was going to say what you said about, is it literally their anatomy they were born with, or are there some restrictions and tissue imbalances that are playing into that? So like you mentioned, when they asked about internal massage, we're definitely assessing the whole body, not just internally and not just the pelvis, but the whole body for kind of those twists or torques and positions. Sorry, also guys, I know we can't all see each other. This is Amy talking. But yeah, just those different twists and pulling to see if it's really just their anatomy, or if there's something that might be contributing to that, creating as much ease in the system as possible, minimizing. We all have asymmetry, we all have our dominant side and all those kinds of things, but just minimizing the consequences, I guess, could be a word for those asymmetries, and making sure that, and I mean, kind of same thing for the tailbone question. And I'll let you address that, Jill, but just taking out the torque of those tissues so that there isn't a quote unquote tight side and a weak side, and those different things, so that there's as much ease and symmetry in the system as possible.
Thanks. And then, yeah, Jill, the question about the tailbone was, what causes the tailbone to hurt? No chair is soft enough these days.
And is that, I'm assuming that's postpartum? That can be pretty common during pregnancy. That's a common one too. So I'm just going to show the pelvis again so you can kind of see. I think this surprises a lot of people, but here's the tailbone right here, the coccyx. It's super tiny, but it has all these, so much muscle attachment to it, and ligaments hooking in that area. So as Amy mentioned, it can be some asymmetry. So one side is kind of pulling on the other. Also tightness. So if the whole pelvic floor has a lot of tension, it's just kind of like pulling that tailbone forward. And so sitting kind of, it's just putting more pressure on it. You can also think about, it sounds like you've tried this surface as you're sitting on, but thinking about what position that you're sitting in. So ideally, when we're sitting, in and not necessarily like perfect posture, but sitting in a more ideal posture, we're going to be sitting more like putting most of our weight through this part, more of our sit bones, rather than kind of sitting back and putting, pressure through the tailbone. So that would be my first thing, would be to just kind of check in with what position are you sitting in, and then putting, like I have a pillow behind my low back, putting a pillow behind your low back to kind of support your pelvis in that more forward position, so that it can just take some of that tension off the tailbone. But then I would guess that there would be some kind of areas of tightness around there. So that would be what we would look at, is we would kind of assess all the kind of areas around your pelvis, as well as those internal muscles that are specifically in the back, and see if we can clear up some restrictions to take away that pain.
Awesome. That's super helpful. Thank you, Jill.
Okay.
I'll let you move on.
All right. Okay. I think I will skip the next slide so we can skip the next slide so we can kind of go over this real quick. So I mentioned, I showed this, this is the core canister. You know, we talked about it changes. We've got lots of sort of consequences to the changes of it. And I certainly didn't go through all the things, but one of the ways that we can kind of start to just get a little bit of balance back through this whole deal is by reconnecting our core with the breath. So it's certainly not a full solution, but it is where I tend to start with with most new moms and during pregnancy, is just kind of trying to get this good breath back and seeing if we can connect with the pelvic floor and the core that way. So first, let's see, like, how does the breathing affect the pelvic floor? So the diaphragm sits on the top. That's our breathing muscle. When we inhale or take a breath in, our ribs, lungs fill up, the ribs open up like an umbrella, like forward, back, and side to side. And that diaphragm that sits like this kind of actually like drops down and comes down into our abdomen, which causes our abs and our pelvic floor to gently release. So we get like a gentle stretch or a gentle release with the inhale. So then on the flip side, with our exhale, we get the reversal. The ribs come together, the diaphragm goes back up, and then these muscles that have been on a gentle stretch kind of get a drawing in effect, or like a contraction. It's a subtle contraction. So we can kind of try that together and just see if we can kind of feel what's going on there. So go ahead and put one hand on your ribs, so like on your lower rib cage on the side, and then one hand on your belly over your belly button. And first, just take a couple deep breaths, and just see if you can feel what's moving. So do you feel like your ribs are kind of expanding outward? Are they moving backwards at all? Do you feel anything happening with your tummy? And then maybe move that tummy hand up to your chest bone and see if you're not feeling much at your tummy, you might be breathing up quite a bit. So if you're feeling a lot of movement in your chest, or you're seeing your shoulders kind of coming up towards your ears, then I want you to maybe put one hand on the belly and the chest bone and see if you can get more air kind of going into the belly. So ideally what we want happening with that inhale is we feel the ribs kind of opening up in all directions, and then the belly is just gently along for the ride. So it's kind of a balanced system. Everything's kind of moving together. Now, if you're sitting down, and especially if you're on a surface where you can kind of position to where you're sitting kind of on your sits bones, you might feel your pelvic floor kind of on that surface that you're sitting on. So as you take that breath in, you can almost feel like your pelvic floor is, see if you can kind of get it to relax or release kind of towards the floor. And sometimes I'll have moms take a rolled up washcloth and put it right underneath their vagina. And that way they can kind of feel what's happening there. So with that inhale, hopefully that perineum or the pelvic floor is kind of dropping down towards the surface. And then if we want to add in, see what happens with the exhale, and we can get a little bit of that deep core and pelvic floor engagement. So we inhale and then exhale, bring the lips, or you bring your mouth closer together, and almost like you're blowing out birthday candles. So inhale in through the nose, exhale. And that gives creates a little bit of tension in that core to where we might get a little bit more of that deep abdominal and that pelvic floor drawing in. We can, as long as we don't have pain around, a lot of pain in the pelvis, because in some cases it's not helpful to be able to do those pelvic floor contractions. But if you're not experiencing pain, you can try with that exhale, just a gentle kind of lifting of or almost like you're trying to kind of lift your pelvis away from that chair. But more, I just want you to think about that exhale and kind of just that subtle, like letting your body bring in those muscles on their own. And with this, this is a good thing to kind of add into just how you move throughout the day, because really they're automatic muscles that you shouldn't have to think about, you know, to be active when you're doing things. So it kind of helps to bring in the automatic nature of them. If you know, when you go to get up from the floor, starting that exhale, like you're blowing out birthday candles, to try to bring in your pelvic floor and your deep abs with that. Getting out of bed is a big one. Or if you're going to lift something, it keeps us from holding our breath, which can increase the pressure, and it kind of blows off some pressure, as well as gets a little bit of that pelvic floor and deep core engagement. So another thing I want to touch on just kind of quickly, but I think it's important, is that we can kind of look at, you know, the muscles as like their own unit all day long. And if we don't have kind of the brain muscle connection, that connection isn't going to happen. So it's hard to reconnect with parts of our body that we either feel maybe shame or that are holding trauma. And so for example, a lot of moms that we work with who've had a C-section, especially if it was an unplanned C-section, there might have been some difficult experiences that they've been through. And so it's hard for them to look at the scar or to touch the scar, because it kind of brings back all of those difficult emotions. And if we're not able to acknowledge a part of our body, then our brain kind of loses its practice with using it. So it kind of creates a disconnect where we can't expect our brain to, you know, use this part of our body that we are kind of wanting to ignore or pretend that it's not there. So I certainly recommend, if you've experienced birth trauma or have difficult emotions around your birth or kind of how your body is after it, to work with a mental health postpartum specialist that can help you process through it. And we find kind of getting that mind-body connection can be super important.
Wow.
So
I would not have thought of that, Jill, but that makes total sense.
yeah.
You don't want to acknowledge a
Yeah.
part of your body, you might have trouble connecting with it. Yeah.
Yeah. So that'll come up when you're, you know, with all the things that we talked about, right? So one thing for anybody who is a meditator, there are a couple good meditations that I like for, these were created by a pelvic floor therapist. So it's on Apple or whatever, those kinds of things, meditations for pelvic health. I really like these ones: health affirmations, breath observation, loving kindness. And where, you know, so especially if you're already a meditator, you can bring this in and kind of bring a little bit of that body awareness to your practice. All right, so we went over a few things, and like I said, it certainly isn't all inclusive, but reconnecting with the core through breath, I think, is a good practice. Allowing that rest and recovery, either to prevent or to kind of avoid some greater severity of the things in early postpartum. And I think moms want to know, when is it appropriate to see a pelvic therapist? When would that be important? So I think for all the things that we've talked about, certainly we advocate for anybody who's had a baby should see a pelvic therapist to check in the whole body, what's going on with the whole body, and where are you at, and kind of what's your baseline after having kids. And a great time to do that is 6 weeks, so that you're kind of early in the game. But if you're 6 years postpartum, it certainly isn't too late to kind of check in with what's going on. And then certainly after 6 weeks postpartum, if you're experiencing any of these symptoms, that the things that we talked about, leaking, pelvic heaviness, pain with sex, I did not talk about today due to time, and Amy's going to be kind of taking us a little bit further with that in April, which will be great. Pelvic pain and then diastasis, that abdominal separation. But after 6 weeks, those are cases that at that 6-week point, you don't need to be experiencing that anymore. And there's certainly things that we can do after doing an assessment and kind of seeing what's going on. Also, it's great to see moms that don't have any symptoms. Like Robin mentioned, it's pretty common to have that grade 1 prolapse that doesn't have any symptoms. And especially if your birth involved any of these things, because these are risk factors for the injury to the deeper pelvic floor muscles. So pushing for a long phase or a really short phase, which I heard one of the moms comment, pushing a really short phase or a long phase, having to use a forceps or vacuum, a really large baby for a vaginal birth, pelvic tearing or perineal tearing, especially a grade 3 or 4, is important to get those rehabilitated. And then a C-section, it is a major surgery. So, and like I said, it's never too late, and sometimes it can, we're kind of working with some of the compensations that your body has come up with over the time to deal with it, but it's certainly not too late, and we can make a lot of progress with it. Any questions about that?
I'm looking at this realizing my last child was 8'14".
That's a big guy, yeah.
Yeah.
Oh my gosh. Yeah, it's one of it is a risk factor for pelvic floor injury. So
yeah, that makes sense.
For obvious reasons, yeah.
Yeah.
Here's my contact information. If you have any questions, feel free to email me, and I'm happy to be a resource. And like she said, I'm in Central Phoenix, Arcadia area. Robin, that's on the call, is in Mesa, and Amy is in Peoria. So between the three of us, I'm sure we can, if we can't help you, then we can find somebody who can. So.
Thank you so much, Jill. This was so helpful and so interesting. And I'm going to have to start really thinking about some of this stuff, because I think, I've slid some of it under the rug. So thank you so much for all this information. I'm going to pop us off of Facebook Live now, so that those who are on the call can ask any more questions they have. And if you are on Facebook Live and you really have a question you want to ask Jill, feel free to join us in the Zoom. So I'm going to pop us off right now. All right. Oh, so good to see everybody's faces again. I always feel like I'm a little crazy when I'm doing that and I can only see one person. Okay. Any questions for Jill?
I'm glad that you asked questions as we went along. That was great.
Yeah, that was really good.
Jill, I just have to say that was amazing, and
cements
my need to see somebody. So
okay,
I did have a question, and you kind of started to address it, but I am wondering, oh, you're still live on Facebook, by the way, Jenny.
Oh, okay.